what has come to the rescue of mankind, I'm saying, not only as a, because whether rich or poor, it's a matter of understanding, but what has brought a revolution, I can say. Correct. I want you to speak on this.
So just to recapitulate what she said, that she said the proper diagnosis is most important for any of the malignancies. And once it is diagnosed properly, then we have 3 different types of treatment. One is chemotherapy, that is medical oncology, surgical oncology where surgeons will remove, and radiation part. So each is part depending on the stage of the disease. If it is very limited, surgery is good enough to take care of that. Once if it is not there, then more than one treatment is required, either after surgery or radiation or chemotherapy. In radiation, we have an excellent tools. Now especially like we have what we call it as linear accelerator based radiation. So we use a multi-leaf collimators and linear accelerator based, where we treat only the involved areas and the surrounding structures like the bladder and the rectum in terms of carcinoma cervix are the main constraints in the past, where the patient used to take treatment and treatment related complications were more rather than the disease itself. So now we treat only the disease part and the potentially the disease wherever the surrounding structures, but it gives very less dose to the bladder and the rectum. So long term complications related to that is resolved. So we have the best of both the world, like we have the treatment under control, or we call it as stage 1 is a curative cancer in carcinoma cervix with the surgery or radiations. With the stage 2, stage 3, we are talking about 60 to 70% survival rate of 5 years now. So in the past we used to talk about 20 to 30%. With the excellent chemotherapy and the biological agents, even in stage 3, stage 4, we are looking about 5 years survival of more than 30 to 40% in stage 4 also. So there is a very good technology which has come. One of the latest acquirement, what we call it as a tomotherapy. It's an image guided radiations, where the time taken for radiation itself is very, very less. And the surrounding structures gets very minimal dose. We call it as less than 60 to 70% of the dose. So they complete the treatment properly, and the disease related things is also taken care very well. In case of endometrium, like in case of women cancers, one of the best thing is all these cancers, if it's identified early, are curative. If you take cervix, if you take endometrium, if you take ovary. So the proper the timing is important, and the proper place where you go is important. Preferably everything should be under one roof.
डॉक्टरांना खूप अतिशय महत्त्वाची गोष्ट सांगल्या की एक काळ आशिल्लो जेन्ना आमी रेडिओथेरपी म्हणजे पावर दिवप, सादें कोंकणी भाशेन ताका म्हणटा की पावर दिवप. ती पावर आमी अशें दिताले की अशें समजुया की एका जाग्यार हो ट्युमर आसा, ताचे भोंवतणी जो भाग आसा तांकां सगळ्यांकूच आमी रेडिएट करताले, म्हणजे सो दॅट एवरीथिंग इज कवर्ड. बट डेज आर चेंजिंग. आतां अशी सिस्टम आसा, अशी नव्या तरेची माखनां आसात, नवे इन्स्ट्रुमेंट्स आसात, नवी टेक्नॉलॉजी एडवान्समेंट आसा की वी कॅन पिन पॉयंट की ज्या भागाचो कॅन्सर आसा, ज्या भागाक इन्वॉल्वमेंट आसा, म्हणजे अशें समजुया एका घरान एक मनीस मस्ती करता जाल्यार आमी त्याच मनशाक उखलून थंयच्यान जेलीन कशें घालतात, सगळे आख्खे फॅमिली करून जेलीन घालनात, तशा प्रकारे दॅट पर्टिक्युलर इन्वॉल्वड एरिया किंवा विच इज लायकली टू बी अफेक्टेड तितकोच इन्वॉल्व करू शकता. सो बाकीचे जो एरिया आसा ते अनअफेक्टेड उरता आनी ताका इट रिमेन्स सेफ. आणि ह्या पद्धतीची टेक्नॉलॉजी आज उपलब्ध आसा, म्हणजे आमच्या देशान सुद्धा आसा. इट इज ऑलवेज अ गुड थिंग सो दॅट पीपल कॅन अवेल दीस फॅसिलिटी. आणि जो भय आसता तो काडू शकता मनांतल्यान. जशें डॉक्टरान सांगला की फर्स्ट स्टेजीन जर आमी तेंचे डायग्नोसीस जालें योग्य वेळार जाल्यार ऑलमोस्ट क्युरेटिव्ह म्हणटात ते, म्हणजे ते एंडोमेट्रियल सर्विक्स आसूं, सर्वायकल कॅन्सर आसूं, एंडोमेट्रियल आसूं किंवा ओवरियन आसूं. आणि ह्या पद्दतीन जशें तांणी सांगलें की हे जे रेडिएशन इज ऑलमोस्ट प्रॅक्टिकली सेफ. आणि टायम ड्युरेशन म्हणजे वरांचे वरां रावचें पडना. हाऊ मच टायम यू युजली टेक लायक फॉर दीस डिफरंट दिस थिंग?
The cervical cancer, 5 weeks of radiation will given. Each day it takes only around 2 to 5 minutes now. Only 2 to 5 minutes. Correct. In that we do a CT scan, and including the CT scan it takes around 8 minutes. So every day we make sure that you are treating in the proper place. We call it as image guided radiotherapy. And once 5 weeks of radiation is over, then internally we do brachytherapy. That takes, we call HDR, maximum of 10-15 minutes of the treatment. The process will take maximum 1 to 2 hours. So in ovarian and in ovarian cancer, there is not much role of radiations. Unless there is a small area which comes back, we use cyberknife in those cases where it's a pinpoint radiation. It is an alternative to surgery sometimes, where surgery is not possible. Some people doesn't want surgery. In those terms we use.
In fact, I have got a very important question for you about the cyberknife. Before that, I want madam to say, like, what is your version, especially about these newer medicines available as a chemotherapeutic agents, as well as because there is a lot of fear. People often they say, let me die peacefully rather than taking the medicine. What do you like to say on this?
No, I mean, these days we have tests like where we can exactly tell you that your body and your tumor will be responding to which kind of chemotherapy. In the past, like we were saying, like, you know, this is the thing which everybody has to get. For this cancer, everybody should get this chemotherapy.
So it was like a buffet, this thing. Now you are very pinpoint, like what you like, only I will serve you.
Yes, and we'll check, does it add to you or no? So when we do that, you know, the response is very good, and obviously the complications, the side effects will be minimal. So we say it's a tailor-made. So like how a tailor takes a specific measurement for you, like that we do and do the chemotherapy. So there are some minimum side effects. If you take any medicine, there will be some side effects. So as I said, but if it is tailor-made, the side effects will be very less and a lady can tolerate the chemotherapy very well.
सो इन शॉर्ट मॅडम म्हणटा की जसे तुम्ही टेलराकडे जाऊन आपले जोक देऊन आपले कपडे शिवून घेतात तशाच पद्धतीची ट्रीटमेंट फॅसिलिटी सुद्धा आज म्हणजे हे बदल जाल्यात. प्रत्येक मनशाक ताची गरज कितें, ताचे सेल्स कशे रिस्पॉन्ड करता आनी वेदर दे आर रिस्पॉन्डिंग ऑर नो कॅन बी ऑल्सो असेस. म्हणजे वखद दिलो पण हाका भितरल्यान कितको फरक आयला ते थरोवन वेदर दे हॅव टू कंटिन्यू द सेम लायन ऑफ मेडिकेशन ऑर सम अल्टरेशन्स आर रिक्वायर्ड. इफ अल्टरेशन्स आर रिक्वायर्ड, वॉट सॉर्ट ऑफ अल्टरेशन्स आर रिक्वायर्ड, ही सगळी पद्दत आनी टॅक्नॉलॉजी उपलब्ध आसा आनी हाचो बरोचसो फायदो जाता कारण तातूंत सायड इफेक्ट कमी जाता. जे गरजेचे आसता तितकेच वखद आमी दिवं शकता. अननेसेसरी मेडिकेशन्स म्हणजे नो ओवर बर्डनिंग अँड ओवर बॉम्बार्डिंग. डॉक्टर, now your very favorite and a very catchy question from my side is your cybernet. What is that cybernet which has brought so much new things in this management of cancer at large?
Yeah, well, see, actually, CyberKnife is a type of radiation machine itself, where we use a robotic, we have miniature the linear accelerator and mounted on a robotic arm. So it's a type of radiations. In a normal one, we talk about whatever the response rate of 60 to 70%. There are tumors where disease comes back, or there is inaccessible to the surgery. Our patient may tell that I don't want surgery. Or like in brain especially where inaccessibility, or there may be areas where you cannot remove fully.
Correct.
Their part is there.
Or even some metastatic points.
Yeah, there is a lesion which is only a single lesion, oligomets we call it as. We do a very precise radiation to that, and we give a higher dose, we call it as radiosurgery. So that the full dose of radiation is given in a very short period, 1 to 5 fractions sometimes, and with continuous tracking system. We continuously track. Because of that, here in a normal radiation, I am talking about 60 to 70%. In CyberKnife, from tumor to 3 millimeter, my dose falls 30%. So accurate, and it's bombarding the high dose of radiations. And recently, around 2 days back, I treated, 3 months back, I treated a melanoma patient with brain mets. Repeat scan shows complete response. So those are some of the responses we see that like and it's a very, very safe and short duration, and patient will tell that okay, we are just slept for some time, so the treatment is over. Patient comfort is very, very high. So it's that can be used for prostate cancers, brain tumors, lung tumors, liver cancers, and in recurrent tumors where chemotherapy is exhausted, surgery cannot be done. In ovarian cancers where there is a tumor which is left out, which is there for 2-3 months, not increasing, not decreasing.
So in short, this technology has given you one knife which you can put without giving any incision on the body.
Yes, correct. It's a totally non-invasive procedure.
Totally non-invasive. So डॉक्टर म्हणटा की आज खंयचेच म्हणजे हे जे सायबर नायफ आसा कशाच प्रकारचे कट करनासतना बॉडीचो प्रिसायजली आनी जो सारको अफेक्टेड आसा ताकाच टार्गेट करून ती ट्रीटमेंट दिवं येता. ताचो रिजल्ट्स बरे आसा, कॅन बी असेस, पळोवंक शकता की हाचो कितपत फायदो जाला. आणि this is one of the point of revolution, it can be said. Doctor, I'm very happy, and I'm sure that though there may be slight apprehension among the viewers that what is the cost of this, but I'm sure with the changing trends and more turnover, more awareness, let's put it in that.
Yes.
So I think the price or the cost factor also go down, and it will be within the reach of every person. Whoever is
all
suffering.
system is for the accessibility. That is most important.
Madam, almost we are on the finishing verge as far as time is concerned. Before we wind up, I would like from you to say what is your take-home message for our viewers, especially the ladies who are watching you and your program.
My sincere request for every lady is that like to have a regular pap smear. As I said, less than 30, they should have a pap smear once in 3 years. And after 30, along with the HPV test, like once in 5 years until the age of 65. Now, one of the things what every lady is blessed with is a HPV vaccine. And that vaccine is a vaccine which is given to prevent cervical cancer. The best time to give is when a lady is still not sexually active, and it comes in 3 doses, and it's absolutely like no complications, just simple injection, that's it. Only thing what they should remember is that even after taking this vaccination, they should go for the pap smear. So going a regular pap smear, we can easily prevent cervical cancer. And any bleeding abnormalities or feeling uneasy, do not hesitate. Most of them, they hesitate even to talk to the husband about these problems. Do not hesitate. As Dr. Sridhar also said, the time is very important. You come to us at the right time, we can diagnose it properly and treat, and I think she can have a cure then.
So, right time, right person, right location. This can be taken as clue words. कारण often what happens, sometimes what happens, I'm just telling you what is a perception in Goa. Sometimes they go to the lady doctor thinking that she's a lady specialist. This is little wrong perception. Means तुम्ही गायनेकोलॉजिस्टा कडेन वचपाचें, जांकां बायलांच्या दुयेंसांचो तज्ञ डॉक्टर ताचे कडेन वचपाचें, ताचो सल्लो घेवपाचो. एज पर हीज रिक्वायरमेंट ही मे गायड यू टू गो फॉर फर्दर इन्वेस्टिगेशन, वेदर इट इज पॅप स्मियर, मागीर तुमचे हिस्ट्रोस्कोपी आसूं किंवा आनी कसलें इन्वेस्टिगेशन म्हणजे फ्रॅक्शनल क्युरेटाज आसूं, बायोप्सी आसूं, ह्या पद्दतीचे डायग्नोस्टीक टूल्स ताचे कडेन आसा तो डायरेक्ट करतलो आणि योग्य पद्दतीन जशें डॉक्टर श्रीधरान सांगलें की इफ यू कम इन टायम दीस थिंग्स कॅन बी कॉन्कर्ड. आणि ज्यो नव्यो तंत्रज्ञान नवे वखदां आज उपलब्ध आसात, आय एम शुअर we can fight with this and still look for a brighter future tomorrow. In nutshell, doctor, we want you to give only one final touching statement.
Yeah, there is always a myth about the cancer. That's what I want, that viewers should not have a myth about the cancer. The biggest worry is the fear. The fear of unknown, fear of cancer. And the biggest slogan for this particular year is, I can, we can. We should always conquer the cancer.
Yes. Thank you very much, doctor. I can जसे डॉक्टरान सांगले, आम्ही सगळेच जाण एकवटीत जावन ह्या दुयेंसार संघर्ष करूया आणि ह्या दुयेंसाचेर संघर्ष करताना आम्ही जैतिवंत जातले हो आशावाद दवरया. देवा कडेन मागया कोणाक हें दुयेंस जावं नये, पण जालां तांच्यानी भिनासतना आत्मविश्वासान कॉन्फिडेंटली जर हें दुयेंस फेस करपाचें धैर्य दाखयलें तर डेफिनेटली वी हॅव अ ब्रायटर फ्युचर. Doctor, thank you very much for your kind cooperation. You have come all the way from Bangalore and share this important knowledge to the viewers of Goa. Thank you very much. Dev Bhare Guru. Namaskar.
Thank you.